This screencast discusses the oral cavity, pharynx, and esophagus. This screencast was designed to help you achieve the following objectives: list the accessory organs of the oral cavity, list the components of saliva and describe their functions, summarize the events of digestion that occur in the oral cavity, describe completely the process of deglutition, describe gastroesophageal reflux disease. In the current and the next screencasts, we will be discussing the physiology of digestion. While our focus will be physiology, you will need to have a basic understanding of the various anatomical structures of the digestive system. However, we will focus on physiology. Anatomy of the digestive system will be covered in detail in lab. We will discuss the physiology of digestion by basically following the pathway of food as it moves through the digestive system. We'll start with the entry of food into the mouth, which is called ingestion. We'll learn how food is converted to a bolus, which can then be swallowed down the esophagus into the stomach. We'll discuss the chemical and mechanical digestion that occurs in the stomach, converting the bolus to chyme, which then enters the small intestine. There, most chemical digestion occurs, and absorption of most nutrients occurs. And the chyme is eventually converted into residue, which enters the large intestine, where some water and minerals and some vitamins are absorbed. And what leaves the digestive tract through the anus is known as feces. So that is a basic outline of how we will discuss the physiology of the digestive system in this and the upcoming screencasts. The first portion of the GI tract to come in contact with food is the oral cavity. So let's outline the functions of the oral cavity. Well, ingestion, or the taking in of food into the oral cavity, is one of its functions. Ingestion involves the teeth, the tongue, as well as the lips, which all help to bring food in to the oral cavity. Then digestion is initiated. There is some mechanical digestion in the form of the breaking down of large pieces of food into smaller pieces of food, and there is a small amount of chemical digestion that occurs as well in the form of the breakdown of some carbohydrates, starch specifically. Overall, the function of the oral cavity is to form the food into a round, moist bolus that can then be easily swallowed. The accessory organs of the oral cavity which are involved in these functions include the salivary glands, which produce saliva, and the teeth and the tongue, which help manipulate food and to mechanically digest it. Let's discuss the role the salivary glands play in digestion in the oral cavity. So there are three pairs of salivary glands. The largest are the parotid glands, which are anterior and inferior to the ears. Below the mandibles, we have our submandibular glands, and below the tongue, lingual meaning tongue, we have the sublingual glands. All of these glands are exocrine glands, which have ducts which allow the secretion of saliva into the oral cavity. The saliva plays several roles. One, they help moisten the food and help the binding of the ingested food into a bolus for ease of swallowing. The saliva also play a very crucial role in the control of bacteria. This is helpful in preventing dental caries as well as preventing bad breath. And the saliva also plays a role in initiating both mechanical and chemical digestion. Let's now look at the components of saliva. If we look at the components of saliva, you are probably not surprised to learn that the most abundant component is water. The purposes of water include diluting the food, washing and rinsing the mouth, and also dissolving the food molecules for mechanical and chemical digestion. There are also antibodies and lysozyme present in saliva. Both serve to help control bacteria by destroying bacterial cell walls. These components are very important for preventing bad breath as well as for preventing dental caries. Mucin is a protein found in saliva that absorbs water to form mucus, and this provides needed lubrication for the oral cavity. Lastly, an enzyme called amylase is present in saliva. Amylase catalyzes the digestion of the starch amylose. Amylose is the only polysaccharide that is digestible by humans. The digestion of amylose by amylase also represents the only chemical digestion that occurs in the oral cavity. I'd like to talk a little bit more about amylase. So I mentioned that amylose is the only polysaccharide that is digestible by humans. Amylose is the starch found in foods such as crackers or bread. Amylose is digested by amylase to form the disaccharide maltose. Now, maltose is a disaccharide and is sweet to the taste. That is why if you are chewing bread or you are chewing crackers, the longer you hold those foods in your mouth, the sweeter they begin to taste. Saliva is constantly being released from salivary glands in order to keep the mouth moist and also to help control bacteria. Of course, large amounts are secreted in response to pressure in the mouth, either from food or objects, such as when the dentist is doing dental work in your mouth. Emotional stimuli, say thinking of a food that you like, or if you pass a restaurant or bakery and you smell the food and it's pleasing to you, through the parasympathetic nervous system, cranial nerves number 5 and number 9, that would be the trigeminal and glossopharyngeal nerves, respectively, stimulate the release of saliva. The other accessory organs of the oral cavity, the teeth and the tongue, both serve to physically break down food and to manipulate food. The teeth, of course, literally grind the food down through a process called mastication or chewing. The tongue helps push the food between the upper and lower rows of teeth. Let's now summarize the events of the oral cavity. So food is ingested and mixed with saliva. Mechanical digestion occurs through mastication or chewing. Chemical digestion is limited to the digestion of amylose starch by amylase, which is found in saliva. The food is then prepared into a moistened, sticky ball called a bolus, which can now be easily swallowed. Note that no absorption of nutrients occurs in the oral cavity, although there are some drugs that are administered across the mucosa of the oral cavity. Probably the most well-known drug is nitroglycerin. Nitroglycerin diffuses across the mucosa, is absorbed into the bloodstream, eventually makes it to the coronary arteries, where it causes the coronary arteries to become dilated. Nitroglycerin is used to treat patients with heart disease. After a bolus is formed in the oral cavity, it can then be swallowed. Swallowing, or deglutition, is the movement of a bolus from the oral cavity here into the stomach here. Believe it or not, it is a rather complicated process. It involves the tongue, the soft palate of the oral cavity, the pharynx or throat, as well as the esophagus. We don't think of it as a very complicated process, of course, and that's because much of it is involuntary. Deglutition can be divided into 3 phases. The only voluntary phase is the initiation of deglutition, which is the buccal phase, followed by the involuntary phases, which are the pharyngeal and esophageal phases. Before moving on to discuss the process of deglutition, let's familiarize ourselves with the structures that are involved in the process. In the oral cavity, the soft palate and the uvula both play a role in deglutition. The soft palate is the roof of the mouth that is posterior to the hard palate. The hard palate is composed of bones, the 2 maxillary bones and the palatine bone. The soft palate is composed exclusively of soft tissue, mainly skeletal muscle. Hanging down from the center of the soft palate is a structure called the uvula. And if just simply having a uvula isn't enough for you, you can always have that uvula pierced, as this person did. Now let's talk briefly about the anatomy of the pharynx. The pharynx is basically your throat. The pharynx is a tube that extends from the posterior opening of the nasal cavity all the way to the opening of the esophagus. And I have highlighted here in blue. The pharynx can be subdivided into 3 subsections. The nasopharynx, which I have highlighted in red, is posterior to the nasal cavity. It is not a part of the digestive system because it is only a pathway for air. It is part of the respiratory system. The oropharynx, which I have highlighted in green, is the part of the pharynx that is posterior to the oral cavity. And the laryngopharynx, which I have highlighted in magenta, is posterior to the larynx. The larynx is the opening to the trachea or windpipe. The laryngopharynx is also connected to the esophagus. Both the oropharynx and the laryngopharynx are part of both the digestive system and the respiratory system because they are a common pathway for both respiratory gases and food. So during deglutition or swallowing, food passes from the oral cavity into the oropharynx, then into the laryngopharynx, and finally into the esophagus, which leads to the stomach. Note that it is important that food not be allowed to enter the larynx, as this will obstruct the flow of air to and from the lungs and cause choking. Deglutition is initiated when food is pushed to the back of the oral cavity by the upward and backward movement of the tongue. This represents the first and only voluntary phase of deglutition, also called the buccal phase. The next phase of deglutition is completely involuntary and is initiated when food enters the oral pharynx. In the pharyngeal phase, the soft palate, including the uvula, move back and upwards, sealing off any possible entry of the bolus into the nasopharynx. The epiglottis, a spoon-shaped structure composed of cartilage, covers the larynx, preventing any food from entering the larynx or trachea. This prevents choking, but it also temporarily stops breathing. The bolus then proceeds into the laryngopharynx. There, a circular collection of smooth muscles called the upper esophageal sphincter relaxes and allows the bolus to move from the laryngopharynx into the esophagus. After the bolus enters the esophagus, the esophageal phase is initiated. Again, this phase is involuntary. The bolus is moved down the esophagus by peristalsis as muscles behind the bolus contract while muscles ahead of the bolus relax. This moves the bolus toward the stomach, eventually reaching the opening of the stomach, which is controlled by the lower esophageal sphincter. The lower esophageal sphincter, which is normally contracted, relaxes and allows the bolus to enter the stomach. Immediately after entering the stomach, the lower esophageal sphincter contracts once again to prevent the reflux or movement of acid from the stomach back into the esophagus. Gastroesophageal reflux disease, or GERD, is a condition where one has a weak or leaky lower esophageal sphincter, and the sphincter allows stomach acid to move into the esophagus. There, the corrosive nature of the stomach acid damages the mucosa, causing pain and inflammation. This is commonly referred to as heartburn because the lower esophagus is so close to the heart. The pain appears or feels like it's coming from the heart. In severe cases, the stomach acid can project all the way up the esophagus and actually through the larynx into the trachea and the lungs, causing damage there. A physician may recommend lifestyle changes such as a reduction in alcohol consumption, cessation of smoking, a reduction in the consumption of spicy foods. Antacids can be used, and some medications that reduce stomach acid may be prescribed. Some women during pregnancy acquire GERD, and this is due to the increase in the production of estrogen associated with pregnancy. An increase in estrogen levels causes that lower esophageal sphincter to become leaky or weak. Typically, this ends after parturition or birthing. Now let's review the objectives of this screencast. List the accessory organs of the oral cavity. List the components of saliva and describe their functions. Summarize the events of digestion that occur in the oral cavity. Describe completely the process of deglutition. Describe gastroesophageal reflux disease. The stomach is the topic of the next screencast.